All right, there we go. All right, let's get started then. I will pass it over to my co-chairs, Amber and Rick, to kick us off.
I don't think we need to introduce ourselves, but what we might do, if you're motivated, open the chat, post your name, what it is you do. For those of our members that are newer, that'll give them a chance to have a better understanding of who we are. But I look through the roster and I see a lot of names I recognize and have spent a lot of time on meetings with. So thank you all and welcome. And I think, Amber, I think our first order of business is to approve the minutes from our January meeting.
Yes, so if you want to take that away, Rick, I think you've kind of done that before, and maybe you can, if you want to do that part, that's great.
Absolutely. So the minutes were emailed to all of us on the 29th of February. I hope you've certainly had time, despite how busy all of you are, to review them. So is there any discussion we need to have on the minutes before we take a vote to approve them? If not, I'll entertain a motion for approval.
So move.
And a second?
I'll second it.
Thank you. So we have a motion for approval and a second. Assuming there is no opposition, we'll designate the minutes as approved by consensus and move into our business.
Awesome, thank you. I think that we had discussed having the remaining meetings quarterly. So Mimi, does that need approval?
Yes.
Okay.
Yes, we need our committee to approve any amendments to the charter. So again, we're moving, as Amber just said, the meetings from monthly to quarterly, just to give us time to research and come up with, some action items from our previous meetings. So, and so the remaining 2025 meetings would just be in July and October instead of every month. So if you guys want to just go ahead and start the motion, if somebody wants to put a motion.
Yeah, could we have a motion to shift our meeting frequency from monthly to quarterly?
I move that we do that.
Thank you, Jean.
And can I add a little something to that as well? So if I know that Rick and I and Mimi, everyone is open to comments. If anyone hears anything new in the marketplace, any interesting discussions, that's kind of what we base these meetings on. Mimi is really good at outreach to see, what has been heard through the market or certain experiences. So please, our emails are in the in all of the chats, and it's never a bother. If you hear anything interesting going on, please reach out to us, because that gives us talking points as well.
Absolutely.
And if you look at the makeup of the SB PAC, the construction, all of your participation is because you have access to communication paths that the staff at the Health Benefit Exchange might not have. So Amber's point is valid. That feedback is so important for the work that we have to do. And please don't hesitate or hold back. If you hear something, if you come across something, email Mimi right away so we can include it in our discussion as we put agendas together. So we have a motion. Could I have a second, please?
I'll second it.
Thank you again. So now I'm going to ask you to vote. So let's do that by the raise hand feature. If you're all familiar, comfortable with that, give us a hand raise. And if anyone is opposed, would you please express that orally so we can recognize that? I think we're good, Mimi. We're moved to quarterly meetings.
That's wonderful. Thank you all for voting, and thank you all for your participation as always. And thank you to the co-chairs for facilitating these discussions. So I will go ahead and move us over to the topic of discussion today. There's been considerable discussion regarding the affordability of small group insurance, particularly following last month's conversation about small group rates and the stabilization of the marketplace in small groups specifically. And so we posed several questions about what regulatory or financial solutions would assist or could assist the small businesses in Maryland in coping with rising premiums. And we received feedback from a member of this committee, which we won't name who the member is, but we have summarized the memo that we received from this member, and we've kind of put it in a discussion format in the slides. And so we hope you'll, pay attention and give us your feedback. That's exactly the kind of discussion we're looking for. And so this memo highlights the following challenges. Obviously, the rising costs, as I said, and premiums, and that make small group coverage unaffordable for Maryland businesses. And then the limited state and federal affordability measures due to economic constraints, and then success of the platform that relies more on just not more than just technology, but more on strong policies and market incentives that are essential. So there were 5 key recommendations. And just to kind of tee us off into the first discussion about level funded plans, the KFF conducts an annual national survey monitoring the employer-sponsored coverage. And among workers at small businesses with 3 to 49 employees, 37 of covered workers in small businesses or that work for small businesses were enrolled in a level funded plan in 2024, compared to just 7% in 2019. So that's, an uptick in, or a large uptick in level funded plans in Maryland and overall nationally as well. And so the first recommendation states that level funded coverage is increasing in Maryland's small group market. And that is part of the issue because and the suggestion says that the attachment point floor should increase from 22,500 to 40,000. And that helps to safeguard the Maryland small group ACA marketplace from claims. And these attachment points function similarly to deductibles and protecting employers from catastrophic medical expenses by transferring the risk of large claims to a stop-loss insurer. And this affects the ACA small group marketplace because level funded plans are not available on the exchange, but sicker individuals are leaving their level funded plans, or the groups are leaving the level funded plans and returning to the ACA marketplace, and that drives up premiums. And so level funded plans also allow insurers to select healthier small groups, leaving sicker ones in the ACA marketplace. And that significantly impacts the rates in that marketplace. So there was a cited example of California's model, which requires an attachment point of 40,000 for small group stop loss coverage. And this recommendation has the following benefits. It aligns with the ACA market rules, protects the ACA small group risk pool, and makes level funded plans less attractive due to higher stop loss insurance costs. So I'm going to open up the floor for us to discuss this recommendation. If anyone has any comments about this. Oh, I see Warren has his hand up. And Eugene, and then Eugene. I don't know. This is just the first one I saw. So go ahead, Warren, and then Eugene.
Were those hands up for the vote, though? I'm not sure that those, I think
Oh.
those hands were up.
Yeah, I forgot to take mine down, but I do have a question though.
Okay, yes, go ahead, Eugene.
Okay, when we talk about attachment points, are we talking about self-funding, those programs that are self-funding below 50 lives when they talk about the solution? But I do know that there are a lot of companies that are offering the self-funded programs for groups down to 10 and below. And so when we say attachment point, are they referring to that in order to make the small group age banded more competitive and comply with the ACA rules?
So any specifics on that, I'm not exactly sure about, what they're referencing, but I think it is from any policies under 50 lives is I think the
No, this is Brandon from Kaiser. It has nothing to do. It's actually, at least for Kaiser Permanente, when it comes to level funded, it's based off a mid to large platform. So it has nothing to do with ACA market rules.
Right. So, and if I can add as well, when we, as a broker, when we quote the level funded, it shows the stop loss is at 22,500. So basically, kind of everything under that is what you would want to say like the self-funded model. So they're just proposing to raise that dollar amount to 40,000, thinking that that will, I don't want to say dissuade, but move groups not towards level funded, away from level funded back into the ACA market. And my comment, Mimi and I had a discussion, and in my opinion, I think that the level funded rate will just reflect that higher stop loss. So I don't know that that would be, a fruitful endeavor to take on. I think it'll just kind of be a wash. I don't know if if United Healthcare is on the call, if they can kind of weigh in on that. But that's my opinion, is that I think that the level funded rate will just kind of, compensate for that higher stop loss. It's not really going to affect the carrier at all. And I think that the rates for the self-funded or the level funded plans will reflect it. So I do think it would be kind of a wash, in my opinion, but that's what they're referring to as a stop loss, with the dollar amount being higher, that the stop loss carrier would pick up with the risk at 40,000 versus 22,500.
And just to add to that, California is pretty much the only state that is trying to stay out of the level funded space. And you can see that here with this stop loss at 40K.
Nikki, you have your hand up.
Hi, yes. I just had a question on the origin of these and kind of where MHBE is in the process of considering these. So it sounds like a member of this work group or committee submitted these to the exchange, and these are sort of in the very initial phases of consideration. I'm just kind of curious where the group and MHBE is overall in considering these.
Yeah, I would say this is just very preliminary. We just received the recommendations and decided to bring them to the group. MHB doesn't have, any one way or another, any opinion on this, but we wanted to bring it to the group as it was provided to us as a potential way to stabilize the marketplace.
Got it. That's helpful. Thank you.
Sure. Any other comments on this?
I think that if we can get more information about this, I see it written, but if someone who does California business or knows a little bit more about it can help us, give us a little bit more insight into it before we kind of make a decision with it. I just think it needs a little bit more research so we can kind of tease this out.
If I can supplement Eugene's point, my fear here would be unintended consequences for that which we don't understand.
We don't understand. Absolutely.
Yeah, I'm gonna make a note of this and see, what additional information we can gather for the group, and we can come back for the on that.
No.
And that would also give everyone more time to think on it and do your own research as well and come back with additional questions or feedback.
And the other thing I was going to say is that since you have organizations like United Healthcare that's selling in California and Kaiser, obviously, they may have some rationale as to, as Brandon was saying, California was the only one forcing the issue. But what has been their experience in California? Did it stabilize the rates at all for them?
Sure thing. Well, I do have a contact in California at their exchange, and can see if they're willing to provide their input on that. All right. So I think we
Well,
can move.
I do have a
Oh,
question though. Since
yeah.
level funded isn't a part of the shop exchange, do we even have that input, or I don't want to say authority, but do we even have that input? Like, can the exchange require the carrier to do anything in level funded? Because doesn't seem like it would be something that we on this panel would really have an input, to me. I mean, if they're not going to offer any of the level funded on the exchange, do we really even have an opinion?
Yeah, I mean, our jurisdiction, I don't think we would have that, but I think we can also look at that. But it would really, I would assume it's MIA. But I know Johanna's on this call, so I don't know if Johanna, if you want to
Yes,
weigh
yeah,
in.
for sure. This is not something that the exchange would set rules around. I think it's something we're interested in hearing discussion about, as part of this broader discussion, or what are actions the state might be able to take around small group affordability. But yes, absolutely, this is not something that we would regulate.
And it would be MIA, right? Just for my own clarity. Okay.
Yeah, I agree. After thinking about it and really looking at this, I would agree, definitely.
Right. All right. So the second recommendation was the current issue, or that's identified by the member, was frequent insurer exits and entries can disrupt the market stability and make carriers or not attracted to that market space. So, or that may make them unattractive to small businesses. So the proposed solution is to implement a mandate to participate in both individual and small group market spaces, and implement a 5-year exit ban for insurers leaving either the individual or small business marketplace. And this would encourage long-term commitment from insurers, promote stable competitive pricing, and ensure fair competition among carriers, and enhance the value of the exchange by offering diverse plans. I did have another slide that just talks a little bit about what we're doing right now with this. We have a 5-year exit ban right now in both marketplaces. Carriers can choose to participate in either marketplace. They can participate in both, or one or the other. And that was done because, we want a free-flowing market and allow carriers to choose a market that fits their business need. So I will open it up to the floor to discuss this a little bit more among the group.
So if a group or a company knows that they're going to enter into a 5-year ban situation, they may possibly increase their rates to offset that risk if they're going to stay in the marketplace. I know that both Kaiser and CareFirst, in particular, being nonprofit organizations, the United Healthcare being a profit organization, I think they have kind of like slightly different outlooks on the marketplace of how they view claims and all. But if this happens, or it's currently in place, I think what will happen, especially with the more profit-making organizations, they will probably raise their rates a bit more in order to remain if they know that they're going to be, they have to take on that risk irrespective of their loss.
Go ahead, Amber.
Thanks. So also, if I can make a recommendation, because I do work both on the individual and the shop exchange, and those of us, Eugene, can we solicit United Healthcare to add their vision and dental as well? It might be a little off subject, but Mimi, I was going to ask you about that because they have very robust vision and dental plans. So that might be, since we're kind of adding VSP, can we also solicit them for vision and dental potentially?
Yeah, all of the carriers that are currently participating have been asked to also participate on the other marketplace, in the small group marketplace. And right now they're at a wait and watch. They want to see how the market does after we release our portal. And so they may because the dental carriers used to be on the small business marketplace in the past. But because there was so much volatility where we were, we went to a TPA and then we went direct to carrier, and we just changed our processes so many times that I think they, might consider re-entering the marketplace if we see growth after the portal launch.
That would be great, because Even Care First has a great DHMO product. It has like adult orthodontics. I mean, it's very rich. So even if those carriers would be open to us asking for that, I think it would be worth it on our side for the shop and the individual exchange.
Absolutely. Yeah. All right. So our number 3 recommendation is to remove metal tier plan limits in the small business market. And this proposed solution wants to remove these plan limits or establish an exception to offer additional plans in small group. And the benefits are obviously increased plan diversity and flexibility, encouragement of carriers to innovate and expand their offerings, and help to prevent employers from seeking plans off of MHC for small business for more options. So this one is pretty straightforward. And I will say that what we're doing in that space is we've heard a lot of feedback from brokers and employers, and our small group policies are mostly driven by brokers. Employers do want to see additional plan offerings. Those are facts. And so we are considering increasing the plan limit in the small business marketplace from 4 to 8, where it used to be 4 per metal tier. We're moving to 8 per metal tier. But we do want to hear from you all to see if that, how you feel about that and what you think about that. But we also want to make sure that carriers operating under multiple entities will be limited to 8 per metal tier across their combined entities. So as you know, Kaiser and United have multiple entities, and so they will still only be allowed to have 8 combined in those metal tiers. So yes, Amber, go ahead.
No, I was just going to comment after you. I absolutely love this. I was probably one of the ones that, responded right away that I love this. And then were you considering having the consecutive levels revised as well? So now they would, you can't do a bronze and a platinum or a bronze and a gold. They have to be consecutive levels. And myself as a broker, it's too close. The rates are really too close to really make a difference. So if I can just put in a suggestion or recommendation on our side as a broker, it would be much easier to be able to utilize bronze and platinum or bronze and gold and not have to have that consecutive metal level. So can that be added into this recommendation if possible?
That's a good point that you brought up because somebody did bring that up a couple months ago. And as a follow-up to that, we did some research, and it turns out that having non-consecutive metal tiers would actually cause adverse risk in the marketplace. So because of that, we moved against that. We went against to we have to keep them consecutive metal tiers, but you have still the option of offering one metal tier, or two. So you still have those options, and for the most part, I think what people do is offer one metal tier, and I think that's kind of what and I have to look back at this, but I have to see what the popular option is in DC HealthLink. But I think for the most part, it's just one metal tier, not two. But you are right in asking for that, and I understand why you're asking for that. But because we did, confirm that it is really an adverse risk issue, that's why we are keeping it the way it is. Yes, Brandon.
No, I was just saying I agree with Amber. With my sales executive hat on, a lot of situations, just speaking from Kaiser, the bronze plans are normally what get people in the door, and you have 3 or 4 individuals from each employee group that need that gold or platinum plan. But having like a silver and a bronze together, it literally just there's not much difference in the plans with the pricing. So I think in a lot of situations, we just miss out on a lot of employees' choices because which one they choose, because they're pretty much the same exact plans. So I think it would be good if you took that up, and they can offer maybe 3 metal tier plans, maybe a gold, silver, and bronze, or silver, bronze, silver, gold, and platinum. But I think it is something to take back.
Mimi, could you help me understand not having the depth of the marketplace knowledge that most of my colleagues on this committee have? Could you illuminate for me what the adverse outcomes might be with non-consecutive?
Right. So if you have a lot of employees enrolling in let's say a gold plan and a bronze plan, and that's the offering, then I believe there is some concerns with that being increasing the adverse risk within those populations of small businesses. But what I'll do is I'll pull up my research again, and I can follow up at the next meeting. But because I'm not remembering the exact data from that, but I will pull up that data and share it.
If it's just me that needs that illumination, you could just share it with me.
Yeah.
Probably some of my colleagues could back you up in terms of what they think those risks might be. So if it's just me for my own edification, we don't have to take up time with everybody else. I'd like to know a little bit more about that.
It's a fair question, and I think everyone could probably benefit from understanding where that adverse risk concern comes in. So I'll pull that up and I'll share it.
Great. Amber's had her hand up.
Yeah, no, I just wanted to agree, and just add again, when we have 10 employees and 4 maybe 22-year-old males, they don't want to pay. I mean, if they can pay $200 per month versus $450 per month, that's a huge, when we're looking from a sales perspective, because we all want this to be successful, right? And our salespeople have to sell it. So, you're looking at a difference between almost double the premium. And when you're looking at younger males, or even a 35 or a 40-year-old male, they're not going to look at insurance the same way as a 25-year-old female who wants to start a family, right? So, I think it is really, maybe Mimi, I know that you're so detailed with that, and maybe if you could just reconsider that based on a sales perspective as well. And really, it's the employees are able to make their own choices of what they want to pay for. So that's what it boils down to, because they can go right onto the individual market and they can get a bronze plan. They don't have to choose a gold because the group has a platinum. So just my
Yeah,
input.
all very good points. And I have taken my notes and we'll circle back. All right. Any other comments on this topic before I move on? There a
And-
hand up? Yes, Eugene.
So the other aspect of that is that if a group is offering a bronze, a silver, and a gold, and the group has employees that are 22 years old and 45 or 50-year-olds, guess what? Those 45, 50-year-olds are going to take that more expensive plan because they make more money. So what happens is that if there's no option, when they have to take these bronze plans with a much greater out-of-pocket risk to them, and they tend to be sicker, you know, without having the full-fledged program that they can get in the gold plan or the second lowest cost silver plan, then they feel compelled to do something different than other than stay in the group. So that's another thing we're fighting against, that they're saying, look, my employer's not offering me anything that I like, because the older people understand the value of insurance. Younger people don't. And so the older people are like, yeah, we make more money, but we'll pay more money because we understand what the risks are. So the more we make the small business program flexible and attractive to not just the younger people, but the older people, I would say people in their 40s and 50s, they're more likely to buy it from the employer and stay with the employer. Because that same employer will call me up and say, yeah, Mr. Poole, I saw it on my company, but it was too expensive. And I found that with my salary, I can go to the exchange. Just I have less than 50 employees. I'll just go to the exchange and get it. So therefore, they have adverse selection the other way. They go into the individual market because they can get a better deal. Why stay with the group?
I agree.
Yeah, I mean, that's good points.
And
Brandon.
I just want to say this lastly. The decision maker is normally that 40 or 50-year-old, right?
Yes,
So
exactly.
so it basically leaves those younger entry employees left out to fend for themselves. So, and that's
Great
those
point.
situations where they'll go back and, you know, if they're 24, 25, they'll stay on their parents' plan.
Yep.
Right. But and if they have the option to choose themselves, then you're giving the option to the employee who is paying for the insurance. The ones who need more coverage can go to the higher levels. The ones who are saying, I don't even need insurance, I really don't even want it payroll out of my paycheck, they can select the lower options, which they can do on the exchange. It kind of gives the employees the choice because it is their money, it's their payroll. They can make the decisions for themselves what level of coverage they need. I agree.
Well, very nice discussion. Eugene, you still have your hand up. Did you want to say anything else?
I keep forgetting to put it back down. But those are the points. I think everyone's made valid points about that, because we think that in the long run, that if we really want to improve the small business market, the better the choices we give them and the more options we give them, the more people will buy it and stay in the program without going to the exchange and put all the brokers in a vicious position, because I got to figure out whether or not they got more than 50 employees, whether or not the employees are going to be penalized, all these different things, because they come for all these different reasons. So I think that the more we make the small business market flexible, not only for the younger people, but also for the middle-aged people and the older people, then we'll have a much better chance of building up the small business market segment, under 50 market.
And my last point to this, and I'll be quiet, it also is counterintuitive to what we want to do with the Maryland Exchange, right? If we're offering these plans from a carrier perspective off exchange, right, it behooves them to go off exchange, right?
That's right.
They are getting those choices where they can offer, 3 plans or 4 plans depending on the carrier. And I think that's the big thing. And I wear 2 hats in this situation. Allison keeps reminding me to look at it from a carrier perspective, but from a sales executive perspective, if we're trying to go the Maryland Exchange and trying to improve business, we need to open up our eyes to what they do on off exchange if we're trying to convince people to come on. And that's the last thing I'll say about that.
I agree, because really, the tax credit is not substantial, so that's not really an
Yeah.
enticement to come into the exchange. So we really, I think that, we all can put our heads together enough and really, we all want it to be successful. We all want these, this plan and the platform to be successful. So thank you.
Very nice comment. Thank you. All right, number 4. The other recommendation that came in was to develop a robust 5-year business plan for Maryland Health Connection for small business and promote the value proposition. And the challenge here that they pointed out is the lack of a clear long-term strategy that may hinder the shop's growth. And they'd like to see us highlight the shop's administrative ease, infrastructure, customer service within the marketplace. And then the proposed solution is to develop and share a 5-year business plan outlining enrollment growth, market analysis, and marketing strategies. Emphasize employee choice, promote tax credits, and highlight the administrative ease again. And obviously, this would build trust with brokers, insurers, and employees, provide a clear roadmap for our program's development and success, and enhance the appeal of the on-exchange small group marketplace as a competitive option for employers and employees. I see a hand up already. Go ahead, Brandon.
I'm very talkative today. I think one of the biggest things that we need to go after is the buy-in from our general agent partners. From you all's perspective, if you truly want to see the shop grow, there are certain general agent partners that do not get involved in shop at all. And in order for us to truly improve Maryland Exchange, you're going to need the buy-in from your GA partners, such as, your Amwins, your Kellys, and so on and so forth. I think that may be the biggest one, because as much as you try to send out emails to brokers, a lot of those times it just goes to spam. So if you can truly get buy-in from your general agent partners, I think that will go a long way in the 5-year business plan in improving your market share.
That's a good point. I was gonna say we do have our program goals and all of that, but I can go into that. We've already discussed all of that in the past, but we've also tried reaching out to the GA partners. A lot of times, I think there's some barriers in that relationship with the exchange, as I think they do view us as also a TPA in a way, competing with their business model. So, and that is absolutely not the case. But go ahead, Eugene. I'll let you speak on that. Wait, you're on mute. Can you unmute
Sorry.
yourself?
Yep. You got me now?
There you go. Yep.
Right. So I think that one thing I've always noticed about the small business market is that a carrier may have a wide variety of products and services that they offer in the small group market, but they only offer about 10 to 20% of the book of choices that they have in the ACA marketplace. They have a lot more products that they offer outside of the market than they do in the market. So I think that what would go a long way to help the GAs to have more buy-in is that we need to have the carriers agree to offer more options because right now I know it's very limited. I can get things off the exchange with the carrier that I can't get on the exchange, and often some of the best programs are not on the exchange. So it has to happen at the carrier level before we can probably convince the GAs that this is a good deal. But the carriers have got to sort of change their attitude toward it too, to say, hey, we're going to offer this as well. That way, there's no loose proposition here. We're not offering you products that you can't get off the exchange or on the exchange. We're going to give you the same programs.
Well, and can I say also, if I can just add to that comment, Eugene, you're absolutely right, and Brandon and Mimi, you as well. You were in the broker community. You know how protective we are about our own books of business. Like, it is competition because it is our money, right? It's our livelihood. So, I mean, even if I get, I get highly offended even when the TPAs kind of took on this, um, habit of, when we do a quote in the TPA system, to reach the sales representatives would reach out to us and say, hey, whatever happened with that group, and we're like, because they would see it on the carrier side, and the carrier would even reach out to us and go, wait a minute, whatever happened to this group? So we just started putting in like fake names. So, I mean, it is that you're right. I mean, the TPAs and the GAs would be very protective and kind of view everything as competition, because it really is in our world. I mean, we can lose a group at the blink of an eye, and the hairs on the back of my neck would stand up, when the carrier would reach back out and go, wait a minute, what did you do with that group? Because they then have that information, and a lot of them have their own sales team, and their own sales team will reach out to the group. So, and we know that through experience. I've been doing this for 25 years. So it is a very touchy subject. I don't know if maybe do not compete, things would entice them a little bit more. But I agree. It's definitely a touchy world.
I just wanted to add something to my earlier point of, how GAs view the small group market on exchange. I think that there's definitely more opportunity now for us to collaborate with GAs and TPAs, because we're giving them access now, because the direct to carrier process in the past kind of left them out of the loop. They didn't know how the process worked, and groups can just go directly with the carrier and say, I'm an on exchange group, and that would leave them out of the whole process. And sometimes carriers were not paying the GAs for on exchange business. And because of that, those GAs were not offering help and support to brokers or employers that were on exchange. So, but now we're giving them access to the portal, and brokers can choose their GA. We have 4 GAs who are interested in participating with us. And I know that's not all of them, but that's still a good portion of them. And so there's definitely way more opportunity now that we're building this system, when we're taking control back of the enrollment process. Yes, Brandon.
Great point. So Amber, I just wanted to give you a bit more information from a carrier side. And you're right. We do have our own sales teams that do reach out to groups, and we do have, our sales teams that reach out to you all to, ask the situations. And from a Kaiser perspective, it's very simple. In Maryland, we have an 8% market share. Actually, it's a little lower. It's like 6. In DC, it's somewhere around 20. With that said, with employee choice and things, we understand Kaiser is not a plan for everyone, right? But a lot of times there are situations where, one of our sales executives may interact with a group at an event. And in those events, they said they never received a quote from Kaiser Permanente, right? So I think we have to do a better job overall, right? And I'm not saying it's you, Amber. I'm not saying it's you, any of the other brokers on the call, but in certain situations, there are brokers that just choose not to engage with certain carriers.
Oh yeah, I certainly agree. I was referring to like when we do a quote in the system and the quote is generated, and then because I have had situation where a carrier has reached out directly to a group that was quoted in the system, and a TPA as well, sales reps inquiring. So, I mean, I agree. We should all quote everything, and every group should be privy to every information, every quote and everything that's available. I was more referring to when there is a quote generated in the system, and then to have a direct sales rep with the carrier level or the TPA either reach out to the group or reach out to us and go, wait a minute, what happened with this group? And that is really the carrier and the TPA using information that we input into the system, and us as the broker work with the client to make the best choice. So that's actually what I was referring to.
Oh no, I'm 100% in agreement with you. It just, I just wanted to give you the perspective from a carrier situation. It just feels like in certain situations, some brokers don't necessarily, as you said, this is their livelihood, and sometimes it benefits them to keep certain groups with certain carriers just because, you know, bonuses and things of that nature. Until we figure out a way around that, I consider it to get a lot worse in some cases, especially with the introduction of level funded to this marketplace and things like that. I know that's not what you want to hear, Mimi, but yeah, I just wanted to give you a bit more. It's just like in the current climate, it's, I don't want to say it's a dog eat world, because we're partners, and I believe all the other carriers that are on the call will agree with my statement. We are partners with you. We just want to make sure that, you know, brokers are doing right by their clients, which in a lot of cases, sometimes we just don't see.
Thank you, Brandon.
All right. Good discussion on this topic as well. And then moving on to the next slide. So then recommendation number 5 is to maximize broker participation on MHC for small business by providing financial incentive to brokers and agencies to enroll new groups through the platform, through the new platform, I assume. And then consider paying broker commissions through the system, and by streamlining the commission payments, by consolidating them and paying brokers directly via electronic payment system through the portal. And I assume this means like leveraging our partnership with NFP, the backend billing provider for the new platform, and then create a fair compensation structure to encourage MHC for small business enrollment, and for at least, I guess, advocating for equal commissions for both on and off exchange enrollments, and implement an elite broker program and ongoing support. This is to create programs that recognize and support the top performing brokers, such as dedicated account managers and additional perks. I would like to hear what additional perks you'd like us to implement, but you know, if any new ideas we're willing to take, but on the next slide after this, I will be going over what those perks are. But I would say that paying broker commissions and bonuses through this platform would require additional state funding, which is not likely due to, as you know, what's going on the federal side of things. We're seeing cuts everywhere, and so what we can do is just advocate for the equal commissions that was recommended in here. But and I think we've already had like a project started around that, and just collecting information to see what the commission structures look like on and off exchange. And in the past, I was not aware of any discrepancies between on and off exchange commissions, but if there are, we'd like to identify them and advocate to see if we can, you know, for equitable and fairness in that commission structure. But I would just go over this last slide here, that we have the top broker perks. We have a couple of our top brokers here that will be joining us tomorrow at the Broker Achievement Awards. And Amber actually is a winner in 2 categories this year. So kudos, Amber. But our top brokers will get it. Yes, our top brokers get their broker profiles will get updated with a digital badge that we give them that says top 2025 broker for each year. They have this badge on their website, and they can put it in their emails, on their websites, to show that, you know, they're a top broker. And then we do a statewide press release, including social media, recognizing all top 100 brokers and highlighting the highest achievers. And I believe this year we have 4 categories. These also, the top 100 get an exclusive invitation to attend an award ceremony we recognize the highest achievers, and like I said, I think it's 4 categories this year. Sometimes I know we were considering 5, but each top broker gets a citation from the governor and award plaques and exclusive perks, like I stated above, and the brokers also get to attend, they get to co-table an MHB sponsored table with us. And brokers also engage with small businesses, generate leads, and distribute MHB materials and their business cards at these events. So if you think of any additional perks that, considering the budget, obviously, that as I stated before, would love to hear it, love to implement it, and you can let us know. Yes, Brandon, go ahead.
Again, if you go back to 2 slides, Mimi, I think going back to working in tandem with your general agent partners, you should take 2 off the recommendation, because basically you're cutting the hand right there. If you're paying, that's half the GA's job, is paying commissions. So if you're truly trying to develop that relationship with your general agent partners, I think if you start taking 1/3 of what they do from them, it will be hard to improve those relationships. I just wanted to make that known.
I understand what you're saying, and that is one of the jobs that I think we did leave back for the GAs, because they do that so efficiently, and so and I do see a comment in the chat. Brandon, do you work with the GAs regarding individuals' family plans through MHBE? I'm not getting paid by Kaiser. All right, I think you guys can take that one offline. But I'm sorry, I meant that in all honestly, just I thought it was in reference to the slides that we were discussing, but option for future discussion. So this is just up for everyone to consider, that we're working on future discussion topics such as offering reinsurance to the small group market and merging the individual and small group markets. If that is something that folks in this group think we should look into, if you think it would stabilize the marketplace, and we'd like to hear from you. And we're considering inviting MIA to address these topics if the group agrees to do so. So any comments on that?
I have a comment. You know, this new program that you have for small groups, allowing the following after the DC Health Exchange format that allows the employee to use their email and to register themselves. And then once they're registered, then they select the employer. I think that could be the precursor logistically for the potential merger in a small group and individual. Because if it becomes one process, no matter who you are, you enroll individually. And then if you've enrolled individually and you leave a group, that if the fact that your information is already there and they leave the group and they want to go to the small business market, you already have the information on the employee. So therefore they can just switch from the employer back to the individual market with the respective tax credits that they will receive. So that could be a precursor. The fact that you're requiring that the individual signs up like they do in DC HealthLink, that could be a precursor of a process that might make that a lot smoother for both everybody and the brokers, because we have to reinvent the wheel every time an employee leaves an employer. Now I got to take that same information, put it back in the system again under the individual market, and it's just a lot of work. So just take that as a possible potential workaround precursor if you're going to do this merging of the small business and the individual market.
Almost like a proof of concept.
Mm-hmm.
Yeah, that's a good recommendation. Thank you. We'll take that back to the group. And I think All right, so I will just open it up to the rest of the group. I know we've been discussing each one as we have been going through the slides. Amber, yes.
The only thing I would add from a sales perspective is I think a broker's the most difficult part is marketing. And, you know, having the badge is wonderful. Having, you know, anything that we can put on our websites and emails and all that is great. Teresa, I think had, or I'm sorry, I can't remember who, maybe it was Becky. She had a scan, like a code scan, that we can just share as we're out and meet people. It was like a square or whatever, like the scan code. And she had some little flyers. Maybe if we could, maybe you could say like the top 20 brokers, you know, you all will help us design something like that. Cause I think a lot of us don't mind maybe the legwork of going and visiting people, although you can't really solicit a lot of businesses, but any outreach marketing ideas that you all can assist us with, I think would be golden. You know, as just a, you know, maybe the top 10 or the top 20 brokers to help us with that marketing piece would be amazing.
I know Rita has her hand raised, but before she says something, I wanted to reiterate that along with the portal launch, we're also launching the outreach and education program where our top brokers could go out and speak to businesses. And we're going to arm you with information and the outreach guide that you can go out to businesses and present.
Awesome.
The options. So that will be coming, that will be in a separate meeting with our brokers, but small biz brokers. But yes, Rita, you wanted to address something that Amber said.
Yep, I think I may have mentioned it also in our broker operations meeting. Maybe I didn't, but one of the things that I've asked our IT team to look into is the feasibility of creating a direct QR code for each broker. So that's something they're trying to see. I mean, you know, of course, right now we are talking about over 2,000 brokers. So maybe this would be something that would be, you know, delivered as a perk just to the top 100. But that is something that they're first checking to see if there's, you know, if they're able to do it.
Thanks so much. That would be great.
I wanted to mention that I currently use a QR code. I use it I have a digital card. I have a QR code on my website. So anytime I meet someone, and on my business card. So what happens is that they either take a picture of the QR code of the business card, or they go to the website, hit the QR code, or a variety of things. I've already implemented those things, and it gives you all of the programs that we offer. And that makes it a lot easier from a marketing perspective, because that's what I currently do now.
Very nice. Very nice. Okay.
Thank you, Eugene.
Yeah. All right. So we're going to open the floor up for public comments. Don't know if we have many folks from the public on this call. I think I see maybe one person on the call like that. So if none, we can adjourn. Rick and Amber, any final comments from our co-chairs?
Yeah, I think the way you handled this, Mimi, was perfect. I mean, we had a free-flowing discussion. We have a little more work to do, but the idea that a member of this committee has some ideas, we should, you know, do the background, put it out there, encourage a free-flowing discussion, and then maybe that points us toward a set of proposals or ideas that we might bring forward. So this was handled very well. We appreciate all the work that you did and the team at MHBE behind the scenes to get ready for the presentation. But I thought this was perfect and exactly why we're organized.
Thank you. Thank you all. And so we're giving you 1 hour back in your day. So enjoy. It's a beautiful day, and enjoy it. Have a great rest of the day. We'll see you in July.
Thank you so much, everyone. Thank you.
Mimi, I registered.
Wonderful. Thanks, Eugene.
All right, thanks. Bye-bye.